The use of an air medical helicopter in an emergency setting can present some unique challenges. But for trauma and critically ill medical patients, a call to Carilion Clinic Lifeguard can mean the difference between life and death. Today, EMS and hospital personnel are more likely to work with an air medical crew than ever before. Are you prepared to call for lifeguard and safely prepare a landing zone? Do you know how to prepare your patient for transport by helicopter? Can you work safely around the helicopter once it arrives? We'll answer these questions, among others, throughout this program. Carilion Clinic Lifeguard began as the first air medical program in the state of Virginia in 1981. Since that time, Carilion Clinic Lifeguard has transported more than 10,000 sick and injured children and adults from hospitals or straight from the scene of the accident or medical emergency. Lifeguard provides critical care treatment and rapid transport to both children and adults, including those with trauma and medical emergencies, burns, and obstetrical emergencies. Over the recent years, there has been an increase in evidence that helicopter transport can make a difference in the outcomes for patients experiencing a myocardial infarction, stroke, and even cardiac arrest through induced hypothermia. Patients in full cardiopulmonary arrest may also be transported by lifeguard if that is the best option for the patient. The lifeguard team will make that decision together with you as a team after landing. Our primary service is within a 60-mile radius of Westlake, Christiansburg, and Lexington, Virginia for scene responses, and a 150-mile radius for interhospital transfers. These areas include Virginia, West Virginia, North Carolina, and Tennessee. The lifeguard helicopters can transport patients to any appropriate facility, and our integration with the Carilion Clinic Health System means lifeguard can save valuable minutes transporting critical patients to Carilion Roanoke Memorial Hospital, Southwest Virginia's only Level 1 trauma center. CRMH is also a primary stroke center with the region's only 24/7 neurointerventional radiology capability. The hospital also has a fully accredited 24/7 cardiac catheterization lab and chest pain center. Patients also have access to neonatal and pediatric intensive care units at Carilion Children's, and Roanoke Memorial houses an on-site transfer and communication center in the heart of the community with a regional ground transportation network made up of ALS ambulances and bases covering the entire region. Lifeguard 10 uses a Eurocopter 135, which has space to accommodate up to 2 patients. It can also transport a neonate patient in a fully equipped isolette with the specialty care neonatal pediatric team. The Lifeguard 10 helicopter has all the safety equipment as recommended by the National Transportation Safety Board. This twin-engine aircraft is equipped with a terrain avoidance warning system, autopilot, searchlights, an aircraft traffic information system, and a satellite phone. As an additional safety feature, the aircraft sends out automatic positions to our communications center every 30 seconds. Night vision goggles are also used to safely fly at night. Carilion Clinic Lifeguard 11 also uses a Eurocopter 135, which has space to accommodate up to 2 patients or an isolate patient as well. It has all the same safety features as Lifeguard 10. Carilion Clinic Lifeguard 12 also uses a Eurocopter 135 with the identical safety features and patient capabilities as Lifeguard 10 and 11. All 3 aircraft are IFR certified. This means that the pilot may be able to fly under special instrument flight rules if other minimums are met when the cloud ceilings are lower than normal. Being IFR capable can also be an added safety feature for those times when weather changes quickly and unexpectedly. The average cruising speed is 120 to 140 knots, or about 150 miles per hour. The speed of our helicopters reduces response and transport times for patients who are in need of time-saving measures. In addition to reducing transport and out-of-hospital time, the Lifeguard helicopters also provide an extension of the intensive care unit through the skill of the critical care registered nurse and critical care paramedic on board the helicopter. The Lifeguard helicopters can reach remote areas and provide transport when icy roads, traffic congestion, and long transport times can hamper ground transport. When there is a long extrication, we can be en route and on the scene when the patient is extricated. If you think you will need the Lifeguard helicopter, call as soon as possible. You do not need to have the patient ready before you call. While you're working on the ground or at the outlying hospital to save a life, a Lifeguard helicopter can be en route. If something changes and you no longer need an air medical transport, we can divert back to base. Calling for the helicopter sooner rather than later could mean the difference between life, disability, and death. This is true for both scene responses as well as interhospital transports. As soon as you think you need the helicopter, call us at 1-888-377-7628. This puts you in touch with a communications specialist in our 24/7 communication center, who then dispatches the helicopter to the scene.
Carilion Clinic Lifeguard, this is Erica. How can I help you?
Erica, this is Kim with Franklin County 911. Just wanted to check and see if Lifeguard is available for the Burnt Chimney area. We have a motor vehicle collision with the possibility of 2 injuries.
Our aim is to get the helicopter launched as soon as safely possible for you. With your initial request, please be prepared to provide our dispatcher the hospital or general location for scene responses, the nature of the call, the number of patients, and your best estimate of the patient weight.
Yes, they are available. Could you please hold for just a moment so that I can tow them out and have the pilot confirm weather for you?
Sure, no problem.
Thank you. Lifeguard 10, go for a scene response, Franklin County, Burnt Chimney area, possibly 2 patients, 1536.
Lifeguard 10, this is Wade.
Hey, scene response, Franklin County, Burnt Chimney area, possibly 2 patients.
Okay. Well, the weather looks good. We can accept, and we'll get the rest of the patient information in the air.
Thank you.
Yep, bye.
The pilot has accepted the flight. It will take him about 5 minutes to lift, and then he will have an ETA of about 6 minutes to you. While he's lifting, can I get some additional information from you?
Sure, let me advise EMS on scene first. Franklin, LZ Command.
LZ Command.
Lifeguard has accepted the flight and has an 11-minute ETA.
When we return to you with the pilot's decision, we will get some additional information from you. This allows us to get the helicopter en route to you as quickly as possible. Once we have the pilot decision to you, we will take any additional information you have, such as radio frequency and coordinates for the scene response, and any additional patient information. Patient information is helpful, but not necessary, since we have everything we need at all times.
Okay, the information I have so far is this is a motor vehicle crash with 5 patients, 2 that may need air transport. I'm not sure as to the extent of their injuries. You'll be landing in a field beside the accident scene. Now the coordinates are north 79.814523 and west 37.10577. You'll be talking to LZ Command on TAC 3.
The process is essentially the same for interhospital requests, except we will need to know your destination up front. If you do not have an accepting physician at the time of your request for Lifeguard, but you know you need to transfer the patient to Carilion Clinic, we can help you with making those arrangements with one phone call. First, we will get the pilot's decision so that we can get the helicopter in the air while we work on those arrangements for you. For interhospital transports, we do not need a radio frequency or coordinates since we will be landing on your helipad or designated LZ. But we do ask that you notify your security of our ETA so they can ensure our safe landing. It is important to mention here that if the patient is on an intra-aortic balloon pump, we will need to know that prior to liftoff so that we can load that prior to liftoff. Keep in mind that although we are IFR certified, we are still unable to operate in thunderstorms, icing conditions, or fog. Our pilots routinely monitor the weather, and we will accept or turn down a flight based on the current forecasted weather between your location and the receiving facility. If there is a question as to whether we will fly, call and we will inform you of the decision. If we cannot fly because of weather, we will be proactive and notify surrounding medevac agencies. While it is possible that another helicopter may be able to accept the flight if their different route provides better weather, we want to make sure all other local helicopters are aware of our findings. We consider this our responsibility and take it very seriously. If you choose to call other helicopter programs yourself, we only ask that you make sure that the other programs know that we have already turned it down, so that a pilot-to-pilot conversation can take place if necessary. Safety is our #1 priority, whether or not we can do the flight ourselves.
Be advised on scene.
For scene responses, it's always a good idea to place someone in charge of radio traffic. Once we are en route, we'll contact you via radio for more information about potential hazards or additional patient needs.
Bert Chimney, LZ Command, this is Lifeguard 10.
LZ Command.
Roger, sir. We just lifted from our base, showing about 4 minutes out to the location and coordinates given to us. Can you give us any information on the LZ, please?
For hospitals, you can expect our comm center to contact you with our updated ETA once we have lifted. In addition to the EMS personnel providing medical care on scene, there are 2 additional important roles for the on-scene requests: the tail rotor guard and the LZ commander. The LZ commander will have the responsibility of setting up a safe landing zone. We require an area which is 100 feet by 100 feet during the day and somewhat larger at night. The LZ should be clear of all obstructions, such as people, vehicles, trees, poles, and wires. We cannot see wires very well from the air, so please tell us about any wires in the area. This includes wires not only around the perimeter of the LZ, but also any wires we might encounter further out on our approach. Keep in mind that we could approach from any direction, depending on the direction of the wind. Wires can be especially difficult to see at night. We will use our night vision goggles to look for clues that there are wires in the area by looking for poles. Remember that the LZ must be level or with a very slight slope. When assisting the helicopter with landing, position 3 emergency vehicles in a triangle 150 feet apart. This is about 60 paces. The helicopter will land in the center of the triangle formed. This triangle can be used at night as well, using any vehicle that has flashing red lights on top. Since all Lifeguard helicopters use night vision goggles now, white lights are not only not needed, they are also highly discouraged. Strobes from a purchased LZ kit are fine, but not necessary. Please just make sure they are not the white lights. It is also helpful if you nose in the ambulance, so that when the ambulance doors open, the pilot's night vision will not be an issue. Please do not use flares or any flammable materials around the helicopter. We also request that there be no smoking within 100 feet of the aircraft. Communicating with the pilot and the medical crew on board the helicopter is extremely helpful and, in most cases, mandatory. Ground-to-air communications should be established as soon as possible. While in flight, Carilion Lifeguard can monitor and communicate on multiple radio frequency bands.
Lifeguard 10, be advised, you have power lines parallel to the roadway to the west. The scene is secure of bystanders. The field is good. You are a go to land.
Let's get a copy, Lifeguard 10, copy of wide open field, no obstructions. We're showing about 3 minutes out from your location. If you don't mind, give us a heads up when you get a visual on us.
Keep in mind that if the pilot sees a more appropriate LZ, he may choose to land there instead. He will communicate this to you via radio. This is rare, but something you should be prepared for. When the helicopter has landed, please do not approach the aircraft. For scene responses, the medical crew will come out and assign someone the role of tail rotor guard. It is this person's responsibility to ensure the safety of everyone on scene, making sure no one gets near the turning rotors. Remember that hospitals may also request that we do a hot load if time is of the essence for the patient, so these safety rules may apply to you as well. If Lifeguard is able to do a hot load for your patient, we ask that you either stay in the emergency department or in an ambulance at the helipad. Please do not have the patient outside on a stretcher. It is also important that the nurse or physician stay with the patient until patient care is turned over to the flight crew. Whether it is a scene response or inter-hospital, it is helpful for the medical crew to know the mechanism of injury or history of present illness, treatment done, status of the patient, and how many patients were involved. Our assessment will be as brief as possible. There are a few things that we would like to have done before we arrive, if you have time. These preparations benefit the patient and allow us to keep our scene time to a minimum. However, if you do not have time to immobilize the trauma patient or start IVs, we can assist you with this once we get there. Our goal is to work together as a team to get the patient to the destination hospital as quickly as possible. Once we receive a brief report and perform a patient assessment, we will proceed to the helicopter with the patient. We would like the help of no more than 4 additional people, 1 person on each corner of the backboard. Usually, the helicopter will still be running. This is what we call a hot load. We always head towards the front of the aircraft, walking, not running. One of the crew members will direct everyone towards the helicopter. At this time, everything must be secured or removed. This means all baseball caps must be removed. Sheets, blankets, and wraps must be secured or removed. Lay any equipment, such as IVs, down on the patient. Never hold anything above your head. As you approach the helicopter, duck down slightly when you reach the outside diameter of the blades. They are the lowest at this point. Once you come up under the aircraft, you can stand up again. The patient will be loaded into the aircraft head first through the rear clamshell doors. A flight crew member will try to position his or herself at a point behind you to protect you from backing up out of the safety zone. Please let the medical crew handle the doors. If a door locks up, we will be grounded until it is repaired, making us unable to transport the patient. Once the patient is in, the flight crew will partially escort you as you exit away from the aircraft towards the front, walking in a crouched position. As you exit, please look for anything that may present a potential danger. If you see anything that looks like it may interfere with our safety, please notify us by radio or motion to the pilot or medical crew. One crew member will always walk around the helicopter to check things out just prior to liftoff. Please maintain your LZ command for a minute or 2 after we take off. In the event of an emergency, this will likely be the ideal place for us to safely land. With the usage of drones rapidly increasing, Carilion Clinic Lifeguard has worked with the Virginia Office of EMS to develop a standard approach for LZ commanders in order to ensure a safe LZ. Assess. In addition to assessing scene safety around the perimeter, a 3-dimensional approach should be taken, ensuring that the area above the scene is safe as well. A standard assessment includes a review of wires and other obstacles in and around an LZ, as well as drones. Communicate. Do not assume that the pilot has a visual on the drone. Maintain communications with the pilot via radio so that you can report drone sightings as soon as possible to maximize reaction time, even if the drone is stationary. Identify. Identify the drone operator if possible and engage them. Inform them of the boundaries and the requirement to communicate their intent to operate a drone prior to doing so. Land. When in doubt, have the operator land the drone. It is always better to err on the side of caution. No video footage is worth the potential risk of an avoidable incident. To summarize our safety briefing around the helicopter, we'll go over the major safety rules again. Assign at least 2 people exclusively for LZ security. 1 person should assume the overall responsibility as the LZ commander. We will assign someone the role of tail rotor guard after landing. Never shine a light of any kind towards the helicopter. Keep crowds back at least 200 feet. Keep all smoking materials and flares away from the aircraft. Secure any loose equipment, including blankets and sheets. Do not approach the helicopter except under the direction of the flight crew. Keep items low, hold nothing above your head. Do not go past the rear doors of the helicopter. The flight team is responsible for loading and unloading equipment. The flight team will also direct loading and unloading the patients. Never assist crew with opening and closing the aircraft doors. And please do not run towards or away from the helicopter. Since Carilion Clinic Lifeguard has been in operation, we have maintained an exemplary safety record. We rely upon all of you to help us maintain that record. Once en route, we will continue the care that you have initiated for the patient. The medical crew will utilize their critical care protocols to ensure that the patient receives the most advanced treatment possible, even before they arrive at the receiving facility. We understand that you will be interested in the outcome of your patient and the flight. Once we have turned over patient care, we will call the AIC or sending facility back to let you know how the patient did during the flight. We also send a formal letter to you to let you know about your patient's definitive diagnosis and final disposition. Of course, if you have any questions in the meantime, please do not hesitate to call our communication center at any time so that they can get you connected to the right person to answer your question. Thank you for trusting us to provide the critical care transport for your patients.